So I would say, as we think about what we believe are related subjects, we think about the survivability as part of the social determinant issue, is we're starting to think about what more do we need to know? How do we have to incorporate that information? And one of the areas that we're exploring is artificial intelligence. And we've started with working with a partner company to develop algorithms that really start to identify the social determinants during the course of cancer treatment, but then also being able to think about them beyond in terms of impact on survivorship. And the way that starts to come together is you may ask that patient on their first visit about their living situation. And you've noted it in your initial note, but 3-4 months later, when you're thinking about a treatment or a next treatment because their cancer initial treatment isn't working and they're progressing and they need something new, we maybe forgot about the fact that they live alone and they don't drive. But we need to know that. And not just what is the implication of that on cost and return to the office and affordability of treatment, what's the likelihood that they will be coming back to the clinic in an emergency situation versus going to an ER versus getting hospitalized? How does it impact on the total cost of care? When we get to the survivorship, what are those toxicities that we're thinking about that they could incur long term? So we're weighing between a neuropathy, which could be chronic and impact that individual who lives alone, versus a neutropenia, which would be short term and has risk but can be managed. And one may be a grade 2, and so thinking the less significant than a grade 4, but the grade 2 could have a lifetime impact as a survivor. So how do you start to do that? And it's so much information. And the mind of the oncologist is always focused on the immediate disease needs, that we're thinking that artificial intelligence may be a solution we can bring to bear to better manage patients, to be able to constantly be reminded of the long-term implications. And it can even work behind the scenes. So you can you can have this artificial intelligence software and then reporting out high-risk situations so that when you order that therapy, it identifies this patient may be a high risk for a long-term problem because of a social determinant that thereby affects the quality of their survivorship. So it starts to get really interesting, and fortunately now there are tools that we're testing, but we believe are going to be effective in starting to close these gaps.